Good day, viewers. I'm lab scientist Chicks Julian Jar, and today I'm going to be talking about sickle cell disease with respect to genotype. Okay, what's genotype? Genotype, firstly, is the genetic makeup of an individual. Before the advent of modern medical science, there was an increase in infant death and adult mortality rate, and these mysterious deaths were affiliated to myths such as the Abicus. Okay, until later on, they actually now discovered the sickle cell gene in Africa. Okay, there are four types of genotype majorly. We have the AA, the AS, the SS, and the AC. AC is a very rare genotype. The AA, AS, and AC are normal genotype. Just that the AS and the AC are carriers of the sickle cell trait. Okay, hemoglobin AA individuals tend to be more prone to malaria. And now, talking about the sickle cell disease, that will now boils down to individuals with the SS gene, the abnormal SS gene. The normal hemoglobin genotype, or the normal blood cell of an individual, is like a biconcave disc. But in individuals that type for SS, they tend to have a sickle cell, especially during crisis. And this sickle cell blocks vessel, and which now causes an obstruction of blood flow to organs. And this brings about so much pain and sometimes irreversible organ damage, tissue damage, organ damage, and the likes of them all. Okay, and these patients tend to go through a lot of transfusion, especially when they become anemic, and if not managed effectively or correctly, they can actually suffer death. Okay, and this message is actually an advice to parents to actually try to know the genotype of their kids just after birth or few months after birth. Okay, this is to help them monitor the health status of their children. Also, to young stars and intending couples, it's actually necessary you know the genotype of your partner. Okay, as before you get too deep in love, because most times, especially in cases of incompatibility, emotions can actually cloud our judgments. Okay, so it's better you know early and know if you're compatible with that individual, and if not, you actually cut off. Okay, and for the hemoglobin AA, AC, AS, and SS. Now, AS, AC, and SS should, I repeat, should on no account get married to themselves. AS, AC, and SS should on no account get married to themselves because of the risk of actually bearing a child that would carry the sickle cell gene. Okay, so that means AS, AC, and SS should marry individuals with the AA genotype. Okay, SS should not marry SS, shouldn't marry AC, shouldn't marry AS. It's a no-go area, and this will help to reduce the sickle cell gene and the trauma and crisis that these children really suffer. I mean, because it's really not nice. Okay, so that's all from the medical stables. Hope to see you some other time with some other interesting health topic. Ciao.